to speak with the staff. The first thing I'd like to do is just to talk about the COVID-19. We have a process in place. We're trying to move to another process where we notify all staff via email, and we've been the teacher aides have been using their own personal emails for many years, and they're not a good communication system when we tried to communicate with them last spring. So we've been working to provide a BOCES email address to all the aides, and it's been a process. There's a lot of reasons why there's a lot of exceptions to the rule, but once we get we onboard the aides, we're hoping to provide a Friday update of the COVID situation. Right now, our process is to do a robocall to the staff of the program that's been impacted with some, rare exceptions. And then I follow it up within a couple of days with a letter to all the staff throughout the agency, so everyone's aware of what's going on. So right now, the summary since the beginning of the year, by the way, BOCES is required to keep a dashboard. It's publicly accessible, but basically a dashboard is an opportunity for anyone in the community. It could be a staff member, a parent, it could be anyone. It could be your own school community. You can go on. It's basically just an updated tabulation of where the school district is with respect to COVID-19 cases. So initially, BOCES were exempt from that process. School districts were required to do it from the beginning of school. One of the reasons they exempted BOCES because they didn't want to have a double count. So, for example, our students who've tested positive, they're all from Wilson Tech. And as you know, those students go half day to a school district school. So if you have a student testing from any one of the districts, they're reported by the home district through their dashboard, and then they would have been reported by BOCES a second time. So it's like double counting. So initially, that was the reason the Department of Health, State Department of Health, gave for not having BOCES, and then they changed their mind, and I guess didn't care about the double counting. So we've been doing a dashboard for about a week now, give or take. But anyway, since the start of the school year, we have 6 students who've tested positive. As I said earlier, they're all from Wilson Tech. They're all from separate programs in Wilson Tech, 6 different programs, and there's been no secondary spread from those students to another student or a staff member. There's a 7th student from Wilson Tech who tested positive, but he's been on remote, so he hasn't been in school. But he is our student because he's a half day in Wilson Tech, but there was no impact on our staff because again he's home. And then we've had 2 staff. One of the staff is someone who had no contact with BOCES. They worked outside of BOCES schools. And there was a second person who was a part-time aide who tested positive. And then we've had one non-employee. Because they were in our school, we felt, we're going to err on the side of caution, and we made the report anyway. Technically, it's supposed to be the employer who makes the report for an employee, They're not an employee, but they're a contracted person. And in any event, in this situation, they're given their job responsibilities. They had no close contact with any staff member or student. This is the one I just sent a memo out on this morning. And the Department of Health said no one needs to be quarantined or asked to stay at home because there was no close contact to any student or staff member by virtue of this person's employment, what their responsibilities, and also in our, interview of him and review of contact sheets. So that's the update on COVID-19. It's interesting. I could make many comments about this. I meet regularly with the leadership of the other BOCES on Long Island, and our numbers are considerably lower than their numbers in terms of positive cases. But I'm sure there are districts out there that have lower numbers than ours. And then there are districts out there, I think it's Shoreham, where they're closing multiple schools. So it's all over the map in terms of the impact. What I worry about, which is what everyone worries about, is the flu season. And I mean, virtually every state is increasing substantially in their infection rates. And that's a serious concern. And Dr. Fauci, who went to the same high school as my father, Regis High School in New York City, who I trust, said we're all in for a big hurt this winter. And he's the head of infectious diseases for the country, and he's a trustworthy individual. So something that we all need to be concerned about. I am, just so happy that, we haven't had any students identify in special ed. It's a real blessing for everyone going forward. So that's the update on COVID-19. I also wanted to discuss the new elementary annex at Deer Park, the Abraham Lincoln School. It's, we opened that up, as I've said before, to provide the opportunity to reduce numbers in classes, give ourselves extra space, and also to be able to take students in this year. I've said it before, I worry about next year, what our enrollment's going to look like. You remember, we graduate a good number of students from our schools every June, and we got to replenish that with new students coming into our programs. So we're not screening the amount of students we typically do. But if everyone should remember, last year at the elementary school, we had a waiting list that went from like 12 to 15, 16 kids. And the waiting list was not like 2 or 3 weeks. It was like 3 or 4 months. And many of these kids were on home instruction. And, it's you want to get these children into school because they needed the school. A number of these kids had very serious disabilities. I know that because I got calls from the superintendents and their parents, but we couldn't take them in because we didn't have one-on-one aides for these kids. But I didn't want to be short-spaced this year because it's we always have to be looking towards the future. We normally have, give or take, about 5 floating teacher subs. I think we're up to 16 now, and we're using these people, as you know, to try and thin the enrollment down. I also would like to try and reduce some of the classes that have 17, 18 individuals. These are classes that have one-on-one aides. And if you know of any retired teachers that, what I'm thinking of doing, we have 7 of our floating sub teachers are teaching remotely. So I don't expect anyone who's retired from us is going to come in and work in one of our schools at this point. And it's not realistic, but they may come in and work remotely. And that would free up one of these remote teachers to go out and, try and thin the classes. So, we're doing well with space so far. The junior senior high school has the highest percent of students who are still has the highest percent of students who are remaining home on in-person instruction. I don't think anyone's surprised about that. Those are the children that tend to have serious medical issues similar to the elementary school. So that's to be somewhat expected, but it's provided us with an opportunity to reduce the enrollment in our schools. We were overstaffed. We probably had about 30 aides resign in September. About half of them came to work and half didn't come to work. And then we have maybe 30 on a leave of absence. If anyone asked for a leave of absence, we gave it to them. And then we had, in the beginning of the year, we had about 30, 32. We were overstaffed for aides. We've kept them all on board, providing different functions in schools. And we want them to be available. So when kids come back from in-person instruction, we want to have staff to be able to bring them back into our schools. So the Deer Park Annex, it's a former elementary school. It's been used by Deer Park for 3 high school classes for children with developmental disabilities. The kids go to Deer Park High School in the morning and they come to the school in the afternoon for about 2 hours, and they have an apartment set up and a store set up. And they basically work on adaptive skills, and they're really sweet kids. I've been there a couple of times, so I've seen them. Very nice kids. The building looks really beautiful. We went in and we did a lot of work, painted, put new air conditionings in the rooms, put new floors in. Did rewired the building for internet. Some of the classes have toilets. We replaced all the toilets in the rooms, in the classrooms. The biggest, your initial takeaway when you go in there and you walk into a room, these rooms were meant for, regular elementary size classes, 25 kids, whatever. And you see, between 6 and 8 desks there. The spacing is really something that that's a real benefit from that program. We invited the leadership of all the unions. I actually went down there and met them, so they'd have an opportunity to tour the building before we opened it up. I think people appreciated that. I think they were impressed with the building. Want to acknowledge Kim Cooper and Joe Lenza, Miranda, and Stacy Caverna, who's the new teacher coordinator down there. There is a full-time administrator down there. Mrs. Alamina is an assistant principal, and she's working out of that building full-time. And wanted to thank Mrs. Gavina, and then all the teachers. When I used to pop down there after work, there wasn't a day I wasn't down there, or wasn't a teacher after working a full day at the elementary school. They were down there decorating the rooms. Want to thank the people for doing that. And it's a great group of teachers down there too. So and Deer Park's been really very supportive. The only glitch we have so far is our kitchen is not, there was a delay from the Department of Health to get a permit to use the kitchen. We only have a serve permit, so the lunches are actually cooked at the elementary school, and then we transport them to the annex. We don't have a permit to cook and serve, although that we're looking to do it. You know, when they came in there, we had to do a number of things to the kitchen. If you've seen the kitchen, you'll see that virtually all the equipment's been replaced, except I think for one device. It's all brand new equipment, and we placed two of our staff members, two of our food service staff members are down there. So that's the annex. I think we have 40-something kids there. Certainly room for growth. And we're looking, I know some of the kids coming back at the second quarter, we have earmarked for that school. The next topic is a new advisement from the Department of Health. It seems every day there's one of these advisements. I mean, if you remember, the governor just issued travel advisories, I think 3 days ago. Well, they're changed today. They changed them again. But what I wanted to share with you is if you watch the news every night, you'll notice that there are certain areas in New York State that have what they call microclusters. And the state has identified those areas by color. And the colors are yellow, orange, and red. Red meaning it's the most intensive rate or the highest rate of infection. And these areas, they're throughout, I think Bronx has a couple, and Brooklyn has a couple, Rockland has some, Westchester has some, Nassau had one area in the southwest corner of Nassau County. Suffolk has none. But the importance of it is the state is trying to track infection rates. And when infection rates reach a certain threshold, the state looks to do interventions in those areas. So let's see if I remember this. I know yellow is the least or the lowest rate. And with the yellow, what I wanted to advise you of, if you're designated as a yellow zone, 20% of in-person students and staff have to be tested once a week. And you have to volunteer to do that. So it's always interesting when I read these things because, you know, we're not a hospital. We don't do testing. You know, you have to have certain licensures to do testing, medical testing. And we don't have such permits. So we could apply for this permit. It's limited something permit. And according to a webinar I was on yesterday, you notice how the webinar comes out 3 weeks after the notice to tell you you're supposed to be doing this? So this limited licensure, which schools can apply for, would enable a school to test students and staff. The testing is voluntary. Students would have to give consent. And the purpose is if you have a yellow designation, you have to test once a week at least 20% of the total population of students and staff in that building. And if you do not reach that threshold, then you're closed. Or let me take that back. You're, as school remains, I think you go to in-person. You know, it's not closed. You go to in-person. Now, the other option is for the school to enter into some type of contractual arrangement with a provider who is licensed to do this. And, you know, that could be, could be a hospital, a clinic, could be many different medical providers. So, so I guess the random testing is coming to your school. The other two zones are orange and red, and in those zones, may excuse me for reading it. Well, I've read it previously. The orange and red zones are more intensive, and in those situations, the school is closed. So it's really, I'm hoping that we don't test out in Suffolk, as such a zone. But the important thing is that and everyone, if you read the information, the governor wants the schools to test. And so this is the first step in that direction, testing in schools. And we're still trying to work through how that's going to be done. Next is the Thanksgiving holiday. So I was just reading that. So they came out with another clarification. This has to do with travel, and I believe it's purposely. It was purposely reconfigured due to the anticipation that individuals may travel over the Thanksgiving holiday. So this is fresh. What I'm reading here has today's date. First off, if they describe and define the other states, they've put them into two categories now. If you remember, there used to be an state advisory list, and the state would update that once a week. And if you were a red state, that was a state that there was a travel advisory, and there were restrictions about when you came back to New York State, you had to quarantine for 14 days. So they've done away with that process, and they have a new system. And the new system lumps travelers into two state categories. First are states, and I'll read it here. For any traveler to New York State from out of state, exempting the contiguous states, the new guidelines for travelers to test out of the mandatory 14-day program are below. So let's just talk about that. Contiguous means the state is bordering New York State. So if you got an A in geography, that's going to be New Jersey. It's going to be Pennsylvania, because if you go to the lower tier in New York State, that's Pennsylvania and Western New York. You wrap around New York State, you go to Vermont, you come down to Massachusetts, and then you come down to Connecticut. So those are the contiguous states for New York State. So it says for travelers who are in another state, exempting the contiguous states, the new guidelines is that you can test out of the mandatory 14-day quarantine. So you remember, when you traveled out of state previously, you had to quarantine for 14 days. For travelers who were in another state for more than 24 hours, right? So a lot of people this summer, you were exempted. If you were dropping your child off at college and you were in and out of the state, you were exempted from that quarantine for 24 hours. Now it says here, for travelers who are in another state for more than 24 hours, you must obtain a test within 3 days of departure from the state. That's why I'm thinking this is all done for Thanksgiving, because you're there for Thanksgiving, and then you have 3 days before you can leave, and that would be presumably the Friday, Saturday, Sunday after Thanksgiving. You have 3 days where you have to obtain a test from that state. So if you're going to Florida for Thanksgiving to participate with your family, you must test, and then of course the test must be negative. Otherwise, if there's positive, you're in isolation. You can't travel. And then the second is the traveler must, in addition to testing 3 days prior to departure, when you arrive in New York, you must quarantine for 3 days. So instead of being 14 days, you must quarantine. And then there's a third provision. On day 4 of the quarantine, the traveler must obtain another COVID test. If both tests come back negative, the traveler may exit quarantine. So when you come back to New York State, you got to quarantine for 4 days. It says 3, but it's really 4, because on the 4th day, you must find a COVID testing site. And if you test negative, then you can come back to work. And that's for travelers who are traveling to a non-contiguous state. For travelers who are in another state for less than 24 hours, the traveler does not need to test prior to their departure from the other state and does not need to quarantine upon arrival in New York State. However, the traveler must fill out the travel forms upon entry into New York State and take a COVID diagnostic test 4 days after their arrival. So if you're there for less than 24 hours when you come back, you don't have to quarantine, but you do have to take a COVID test within 4 days, or actually 4 days after their arrival. And you know what that is. We've discussed that before. The 4th day, that's if you test after 4 days, they consider you not to be infectious. Okay, so, just reading this, so this has to, I have to work up, I'll work with the personnel administrator to get this out to all staff, so everyone has this information, but it's literally just got this afternoon to read. It's important, so I wanted to put it on there. I'm gonna send a letter out. People are free to do as they wish, and I know that I worry about we come back to work on Monday. Everything I see and read is be careful about group meetings in a closed setting, like dinners. Read about someone went to a wedding, and this was in Georgia, and it was like 24 people, just immediate family, and 16 out of the 24 people tested positive within 1 day. So who the heck knows what happened, but it's tough, because I drafted a letter yesterday, and I haven't seen my grandchild in over 10 months. And my wife's retired, she teaches at the university, but she's usually flying down there every month, and hasn't, because of the travel restrictions. So it's very difficult. People are they're anxious to get out. You haven't seen your kids, your grandparents, your parents. It's very difficult. Anyway, I'm not going away. That doesn't mean other people, you do as your adults, do as you wish. But I always think about, if I get sick, who I'm going to infect other people. I'm less worried about myself, who I'm going to infect. So it's very, very difficult, very, very emotionally charged situation. And, just please be careful. Whatever you do, please be careful. The other thing I read, I got to remember to read the pressing things at the end of the day instead of the beginning of the day. But I was in another meeting yesterday, and I was reading a research report. Now, everyone should know that New York State is in a $15 billion budget deficit this year. And the New York State Division for Budget released a midterm report. Remember, the state budget goes from April 1st to March 30th. It's not a calendar budget. So the Division of Budget not for the state ed, for the governor, released an interim report 2 days ago. And they said the 4-year projection, including this year, of the budget is supposed to be $63 billion, $63 billion. Next year, they're projecting a lower deficit of 8 billion. That's with a B, billion. So this year it's a 15 billion. Next year it's an 8 billion. And that's going to have just enormous impact. You need me to tell you that. You need to hear it. The governor withheld 20% from the first payment for school districts. You read about that. Withheld the 20% for BOCES aid. So, so districts are not getting any aid when they send a child to BOCES, which is very important for us, it has, this whole discussion about equity. So, you probably know I've been immersed in wine dance for 2 years at the direction of the commissioner because they overspent their budget by $3 million. So, I know their financials very, very close. They have a $70 million budget and 49 million comes from state aid. So, run the math on that. 20% reduction in state aid this year. If it follows for the whole year, what's 20% of 49 million? It's over $9.5 million. How do you deal with that reduction in your budget? $9.5 million. And this is a district that just let go of 110 people last year because of their budget deficit. So when you make these reductions across the board and you say, like the governor did, we're going to reduce state aid by 20%, that is not equally felt. You look at that and say, well, 20%, everyone gets 20%. That's fair. It's anything but fair. Because if you go to where my office is in Half Owl Hills, their state aid is like around 5 or 6% of their budget. So, so in Wyandanch, it's roughly between 67 and 68% of their budget. So when you take 20% away from a poor district, that has an incredibly disproportionate negative impact on what is already an impoverished poor community. And I don't, and by the way, these poor districts, they don't have these reserves that that richer districts have. So it's not only unfair, it's terribly unequitable in terms of how that reduction is being applied across the board. So very, very serious. And I know this is something we'll all remember for the rest of our life, the election of 2020, which I think is still being counted out, but making an apolitical statement, okay, apolitical. We got 4 rounds of stimulus funds to the states back early in the COVID-19 pandemic. There was money there. There was a $1,200 check for people, I think, under a $75,000 salary threshold. And there was an enhanced benefit for people on unemployment of $600 a week, so on and so forth. But they never gave the states the money equitably. So when the only stimulus federal money that went to states, they computed it based on the number of Medicaid or Medicare patients, which back in May was crazy, and June, because to me you would distribute that aid to states that needed it the most. So if they had states, they did a study on this. You had states that were getting sizable amount of monies that out in the Midwest, Dakotas, Wyoming, and they have one person with COVID-19, and you have New York State that had tens of thousands of people. So there was no proportionate reason to distribute that aid. So depending upon what happens with the election, again, apolitical, New York State, and by the way, it's not New York State, it's all the states that have been hard hit. And if you listen to the news at night, the infection rate is going up significantly. In the last 8 days, it's gone up significantly across the entire country. So it's serious stuff in terms of the health. But, without federal stimulus, many have probably heard about, the recession we had in 2009 and 10 in New York State. We had a huge budget deficit, and it was the only time, well, there were 2 times in the history of New York State, but that was one of them where the state came in and reduced the state aid in the middle of the year. So, but they called it gap elimination aid. It took the state like 4 or 5 years to start making up the loss of state aid. So we all need to keep our eye on this ball in terms of what's going to happen. And it is interesting that whoever pays these pollsters, boy, did they have it wrong in projecting elections, both locally, regionally, statewide, and nationally. Interesting results. And then the last item is, I've spoke about this before. Weston Suffolk BOCES has a diversity committee. Truthfully, we haven't got up and running this year because of all the demands. Jen Sommer is one of the co-chairs, and Stephanie Engelman's the other co-chair. Weston Suffolk BOCES just finished an equity program that we developed with we reached out to 5 very prominent leaders locally and experienced in training on race relations. Some of them you see it on TV. I've seen Elaine Gross from Racism. Tracy Edwards, she's the regional chairperson of the NAACP for Long Island, a former board member in Elwood. In any event, we pick people who are prominent and have worked with the communities and schools, and we asked them to develop a program for the superintendents. And it was an 8-session program. And I was meeting with the superintendents every week this summer because of the craziness. So we said that, would you attend the program? And all the superintendents signed up from Weston Suffolk BOCES, and they just completed the 8-session course. And I want to extend that to other members. We asked the presenters to get together and create this program, which they did. So I'm going to extend it to the administrators. I'd like to extend it to the diversity committee, and then to the union's leadership. And then, so you receive that insight. It's all very interesting, and I promise you're going to come away with information you never knew about. That and it's helpful. And we reached a point in our country where we, as uncomfortable it is for most of us to talk about race relations, we need to start doing it. What happened to George Floyd was terrible. It was terrible, and everyone saw it. Everyone, we all bore witness to that. So I know you're going to support it. I'm going to, keep it on the agendas. I have it on the agenda with the board. I've done some things with the Board of Education. So, and this is not something that you start and stop. It's really something you start and you continue it, and forever, and the discussions are always, this training, you're not going to sit back and doze. It's interactive. You're going to be put on the spot. You're going to be asked in the group to, what do you think about this? What do you think about that? And it's a very personal experience, a very informed experience. So that's it. And I'm looking at Jen. Jen, that concludes my comments. And I was on there for, I guess, about 45 minutes. So is there anything I can do to answer questions you have there for me?
Yes, we do have some questions. Thank you so much for that information. Larry, are you jumping in? I like raising your hand. Thank you. Good student.
Hi, good afternoon, Mr. Flynn. Thank you for being with us today.
Thank you for inviting me, Larry.
Sure. At the onset of September, a memo came out from your office pertaining to the protocols of mask wearing for staff members. And, you know, it was like all staff members must have their masks on, with students present at all times. No staff members should remove their masks with students present. Due to this requirement, no eating or drinking can occur with students present because you would have to remove your mask. Now, you know, for some of us, we have the luxury that we have a little flexibility in our day to accommodate for that. But in some buildings, in some programs, based on scheduling, staffing, and coverage, mask breaks for some of our staff members are hard to come by. And of course, wearing masks presents all sorts of issues for us: fatigue, headaches. Sometimes we're lecturing for 30 to 40 minutes with the mask on, and it could be very, very uncomfortable. Do you think we can possibly look into having water breaks with our students in classrooms responsibly, of course? Not asking to be overly, you know, irresponsible with this, but I think we've been accustomed enough to understand what is safe and what is accountable. So I think water breaks could go a long way for those teachers who are having problems trying to arrange scheduling for mask breaks.
Well, you know, thank you, Larry, and I appreciate the question. And it's very difficult. I've said this before. Everything we do is to protect us, you know. And, you know, one of the things I own up here, if someone gets sick, you know who they call first? Me. And I take that responsibility very seriously. I don't want to be the bad guy here, but I will be the bad guy to protect people. And I fully respect and appreciate everything you're saying. You know, when this whole thing broke, I tried to wear an N95 mask for the day one Saturday. You know, you can't do it in the summer when it's hot. You just can't do it. And you know, different people have different reactions to it. So I want you to know I fully understand and respect what you're saying. That's not the issue at all. And what you're proposing is more than reasonable. You know, I worry about, you know, the 7 students that tested positive. They're all high school kids in Wilson Tech. And, you know, we read the paper all the time. They had 2 weeks ago or last week, they had 400 people in a party in Brooklyn without masks on, you know. You know, people, in my opinion, don't have the right to do that because you're going to go out and make other people sick. So it's, and, you know, I'm not an expert. I'm like you. I'm just trying to do the right thing to protect people. You know, I don't have any special training other than I read about this stuff, what you should do, what you shouldn't do to try and protect people. I know that I've had this conversation before about, I've asked certain people, maybe it wasn't your group and maybe it was, I don't know, but just, you know, suggesting to some of the principals, maybe people like open up the door and, you know, take their mask off. You know, I'm talking about the elementary, junior, senior, because those buildings don't have windows, and that's a problem too. You know, you have the doors, but, you know, ventilation, I'm learning, is a big key to this too. It's not just mask, it's many factors that contribute to it. And there's nothing, you know, drinking water every day is a beautiful thing and it's healthy and you have no argument there whatsoever. I'm 100% with you. I'm very thoughtful and deliberate before I make decisions like this. Because the last thing I want to do, you know, students, up to 40% of students I've read and I've read this repeatedly, are asymptomatic and have the virus. We've had one of the kids or two of the kids in Wilson Tech were completely asymptomatic. The only reason they tested positive is someone else in their family tested positive. So that's why they went to get tested. And it turned out they tested positive and had no symptoms. So, if you listen to Dr. Fauci and you read all this stuff, which I do, almost half the kids have the virus and they're asymptomatic. They don't know it. We don't know it. And now we're talking about, some of our classes have a lot of adults, particularly with the more impaired children. And now we're going to expose our staff to kids by taking their mask off when we know that's one of the most important things we can do to prevent the spread. And, Larry, you say a prayer and you try and balance, what you're saying against the health and safety of adults, some of whom can become very, very seriously ill. And we know that. And so I never react to this. And I don't want to minimize. I'd love to have people drinking water. It opens up, what I said to the principals, why can't somebody open up the door and take a swig at the door and just step out and take your mask off, to have a couple of minutes. I'm all for taking the class outside and go for a walk, all for it. I've said it repeatedly. I'll say it again. You can record me. It's not about doing 40 minutes for a history class or a what class. 30 minutes is perfectly fine if you're going out and taking a 10-minute walk around the school. It's good and it keeps us safe. And we have to give up 10 minutes of time here and there. So be it. I'm just telling you, that's not important to me. What's important is keeping people safe, healthy and safe. I don't mind having these discussions. I mind making a decision, and I would never make a decision until I speak with the principals. And, when I speak with the principals, I don't speak for them and I want to represent that, but I can tell you that they share the same burden that I do. They feel very responsible for their school. And I'm not saying that you're not making these requests very sincerely. You did a great job of laying out, the challenges for staff every day, wearing a mask all day long. And I respect that. I understand it. And I want to respond to that in a way that's safe. But it does concern me to say that, we're going to have a mask break. Now, you've been down to Deer Park with me.
Yes.
I've seen some of those classrooms. And, there could be certain situations where you'd say, gee, the increased size of the classroom or the space could possibly lend itself to do something like that. But the problem is when you do that in one building, you don't do it in another because certain classes were not able to do that. When you go outside, that's the ideal time to do it, to do it outside, and to me, it's not interfering with the school day. It's keeping people healthy. It's not a negative thing. It's a good thing to go outside and go for a walk and deep breathe. Let me think about it and I'll speak to the principals. I can tell you though, when I speak to them, about the water breaks and things of this nature, it's not that they don't understand what you're bringing up. It's that they own the responsibility. They know that it's on their shoulders. You walk in that building, you put 50 pounds of weight on each shoulder because when there's a problem, they call the principal or the superintendent and you own that responsibility. And when it comes to people being very sick, I take that very seriously. And I think about it 24 hours a day, trust me. So I thank you for bringing it up. I always enjoy these comments. It informs me, it helps me make decisions. But, here we are, we're going into the flu season. It's, is it the right time to do it? Even if someone doesn't have the COVID virus, do you want people's illness and flu around, so on and so forth. But I thank you for mentioning it. I do have conversations with the administrators regularly, like I'm doing with you. And I wrote it down just to get their input and we can keep discussing it. If there's something that what concerns me the most about what you said is doing it with students taking their mask off. Because it's rare that an adult is asymptomatic. You know, it could happen, but it's rare. But it's more common in students, and then certain age levels of students, it's more common. More common for teenage students, I've read, than it is for younger students. I don't know. Let me think about it. I thank you for the suggestion, but the one thing that concerns me is the notion of, you know, putting some of our classes have 6, 7, 8 adults in them. You know, how would you ever manage taking off masks there and then exposing people to illness? I mean, it just, you know, sometimes you get this reaction. I'm getting this reaction. Is that the best thing to do to keep people safe? And I'm saying no to myself, but I'm always a believer that 2 people are better than 1 making a decision, and 3 are better than 2. And I appreciate all the suggestions and thought, because I know you're getting this from staff and people are frustrated. You know, and yeah, I read this, you know, this thing about this wedding party. It kind of stuck with me. You know, 16 people out of 24 people test positive within 24 hours. And because it was a wedding, you know, and the parents went, and the groom's parents, 2 of them in the hospital, one's in intensive care. And this is the stuff I worry about. I'm sorry to give you such a lengthy response. Anything else you'd like to add on that?
And just to be certain, these wouldn't be prolonged mask breaks. We're talking about a sip of water just to help cope with the mask when in class and giving instructions. So it wouldn't be something where you're taking it off for an extended period of time. It would be just enough for you to get some water to help you with it and carry on with your instructions.
Thank you for that clarification. That's very helpful. Thank you, Larry.
Yeah.
Thank you. Next question, please.
As we look, next week is the end of the first quarter, and we are talking about students returning, and I know that we've had some students return. Will there be training for those students and families as to what to expect when they come back to this? You know, we've all been in this environment now for about almost 10 weeks. Will they be prepared now to return to school and understand, you know, what school looks like now?
In terms of wearing masks and PPEs, Jen?
Correct.
I don't know. It's a great question. Thank you. I'll write it down and I'll include that in there. You know, I know that when we opened school, I sent a letter to parents, and I'm sure you have people who are listening in on this from Wilson Tech. And I ask this question all the time, and I told the parents there's no exceptions to wearing a mask, except if you have a medical condition, so on and so forth. And we never got those exceptions. So, you know, we want to make our communications clear. With special ed, obviously, it's very different. I think, you know, I'm thinking that based on conversations I had with parents this summer, I'm thinking that parents with children with special needs, they're not taking them out of the house. They're very protective of them. They're staying home. They're not exposing them to a lot of this. At least that's what I've heard from a lot of parents. And I'm happy to hear that. But what can happen is you can pick it up from another sibling or from a parent in your home. It's a great question. Thank you for asking it. I will follow up. Thank you, Jen.
Thank you. I'm just going to piggyback on that one a little bit. Excuse me. As we've been in this situation and we have learned how to cope, will there be follow-up training provided for staff and students, again, as to proper PPE and, proper precautions? Will that be an ongoing, I think, and I don't want to speak for CTE, but I think that there was something that had to be shown to their students, a PowerPoint, if you will, about proper precautions, only because the guidelines from the CDC and Department of Health are so vague regarding a mask break and certain etiquette. Is there a way that we can, continue to provide comprehensive training and information to staff and students as we continue throughout the school year?
Yeah, I agree. What's not to agree with that? There's no downside to that. It's all upside. Well, particularly for new kids coming in, I like that idea because they may not know what it looks like. But, we did a lot of heavy lifting in the opening weeks of school, and it never hurts to remind people and, reinforce good, safe practices. So, and I know, we put a lot of work. A lot of the teachers were part of that process into developing different protocols over the summer for the opening of school. So I'll add that to my list for the meeting. Thank you.
Excellent. And I see we have a question here in the chat that a student in a class tested positive for COVID. They completed the quarantine period and should be returning tomorrow. Is there documentation that students need to return to school or staff? Thank you for the question, by the way. So when somebody's coming off quarantine,
Yeah.
Student or staff, are they required to provide documentation?
The answer is no for quarantine. The Department of Health establishes the length of the quarantine at the onset. And that length of the quarantine is a metric that is determined by when the person gets symptomatic, when they go for their test, and when we find out about it. We've had a couple of situations where some of the Wilson Tech kids, or at least one, I think he tested positive. He was in a soccer tournament, I think at Sachem, whatever, but we didn't find out about it because he was home, the quarantine period for situations like that can vary, where some people could be quarantined for 13, 14 days and other people for 5 days. The reason I'm mentioning is that the Department of Health, one, determines the quarantine period. Number two, they contact the staff member and they let them know, or the student, the family, they let them know the period of quarantine and when they're permitted to go back to work. And three, they let the school know that quarantine period when it's up. We're learning a lot. So, I just learned that you could have tested positive for COVID-19 and still test positive, but not be contagious. That was a question we had of the Department of Health today. So the answer for people on quarantine is that if you're asymptomatic for the 14 days or for the period designated by the Department of Health, you're able to come back to work after that quarantine period expires. And for isolation, it's different. That's for the person who tests positive. You're not permitted, and when we have a situation, we've had situations where we don't permit staff or students to come back until they produce that written documentation that they get from the Department of Health. And that does not mean, I've been very clear with the principals, they don't produce that when they walk into the building. They produce that before they walk into the building, the day before. We want to make sure the documentation is proper, it's safe. And then, there's been some glitches. We had someone get an email today in one of the programs who was quarantined. It was from the Department of Health. And it said, you're quarantined given a later date. Didn't make sense. And we called up the Department of Health, gave them the name of the person. They had the person in the registry. And they said, well, sorry, that's a glitch. You know, the system automatically sends these letters out. And this is someone who got one of these letters a while back for the quarantine. And then they get another new letter that was sent out in error by the Department of Health. The important thing is when the person got the letter, they went immediately to the principal, who immediately called me, who immediately told the principal to get the nurse on the phone who handled that case, who immediately checked into the registry and told us that that letter was sent in error. So, but we have these glitches that come up. The important thing is, you know, report it immediately, we'll respond immediately.
Excellent. When will teachers be notified if they're in a virtual situation right now and perhaps more students are returning? When would a teacher expect to be notified that they are going to return to in-person teaching?
When we've made a decision to open up new classes, it's you know, it's never a simple process. So kids come back and they could be spread over different age ranges, different levels of function. You know, they don't fit tightly into a designated or the best, you know, enrollment, best cohort for enrollment purposes. And you want to always consider that when you're comprising your class. On the other hand, you don't want to take a class and start redistributing kids because you want to create a better instructional cohort. You know, so there's always pros and cons to these decisions. I can tell you they're never simple and they're never easy. And then you have to take a look at the nature of the children coming back and then the people who are on remote. So I can tell you right now what's going to be an issue. If Mike Flynn is selected to come back from remote and I don't want to come back, you know, I'm the first person to say, why are you picking on me? You know, can't you pick on someone else? Because there were a lot of people who wanted to work remote. You know, all things being equal, you know, we don't mind asking people, but things are never equal. We may, you know, pick someone for a particular experience or a skill set that they have. But be assured that the principals are working on this. They have been working on it for 3 or 4 weeks because they've gotten calls from parents of kids that wanted to come back. We have made exception, as you alluded to, where we have let some kids come back prior to the quarter where we felt there was a need to do that based upon the needs of the child. And we don't want to keep kids out of school who need to be back in school. So, you know, we do make exceptions to that, but generally speaking, it's part of the process of looking at which kids are coming up and then, you know, creating a cohort and then pulling someone off a remote class. So as you can appreciate that, it can be a nightmare. You know, I can tell you that Eastern Suffolk BOCES, and you probably know this, their teachers teach the class and the remote kids, both. You know, and that's how they deal with this issue. So that when kids come back, they're coming back into that class that they've been, and it's the same teacher who's been teaching them remotely. You know, that works, except, you know, having a teacher teach in special ed in particular, in person and then teaching the, you know, the remote at the same time can be challenging. We didn't do that, obviously, but everyone has a different, you know, view of having to accomplish this. Next question, please.
This is a CTE related question. When will students be able to do the hands-on part of their classes? There are seniors that need 250 hours of working with real people. Is there a timeline for them to be able to actually work and do their hands-on experience?
I guess this is like kind of like an internship type of thing, Jen. That's the,
yeah, that's what I'm assuming. Yeah.
Yeah, I don't know the answer to that. I do know that I do know the answer for adult students because it came up, because we have quite a number of adults in our medical programs, surgical technicians, sonogram technicians, and they're obviously required to do that experience. And they're able to go into hospitals and able to do that. They're exempt. They're considered exempt people. So for them, they've been doing their actual hands-on practicums. But for students in tech, I don't know about that. And I'm in no rush to have them do that, to be perfectly frank with you. But it's a good question. I'll ask Mrs. Kelsey. And
I appreciate that. And I just want to clarify, it may not necessarily be for an internship. It may just also be part of their curriculum.
well, if it's part of the curriculum, then I have a different answer for you. So, anytime anyone comes near my desk, I take out a wipe and I wipe my computer down, whatever. So let's say I'm working in automotive and I'm working on, I don't know, taking the carburetor off, whatever. And that's something that's really important. So if you have mask on and if you're socially distanced, I don't see any reason why someone can't take a wrench and wrench off a bolt or whatever. Now, well, what do you do with the wrench before you give it to the next student? You clean it off, you wipe it down. So I don't see, when I used to go to the tech programs for auto, if someone's working under the hood, it wasn't uncommon to see 2 or 3 other kids around that kid with the teacher because you're teaching them something. And, they're literally on top of one another. Obviously, you're going to use good judgment, not do that. But I don't see any objection to doing hands-on work. And I don't like to make blanket statements like that because I never know, there could be situations where that wouldn't apply. But, the teacher should go to their principal. And if the principal has a question, they'll go to their director and they'll go to me and we'll make a decision and, and put it down. But it's really about using good judgment in terms of your social distancing and wearing your mask, and then using good judgment about, wiping things down before, you hand them off to other people.
All righty. Thank you everyone who submitted questions in the chat. Ernie, do you have anything to add? Oop, who's this?
I'm here. No, I'd actually asked Devin, maybe perhaps she has a number of questions to ask from. Oh man, did I get a line? Hello? Oh, Jesus Christ, what the hell? Hello, can anyone hear me?
Ernie, I can hear you now. I couldn't hear you before.
Oh, I'm sorry. Something happened, but no, I left it up to Devin to ask questions or anything that came up. Jen would handle it. I personally just wanted to make sure that everyone were able to ask the questions and get the answers. I know Miss our speech therapist had a major question, but I guess she's not online. For her to ask the question directly, because I wouldn't know how to ask the question. Is she, Ronnie Eisman?
In the chat.
I'm sorry?
I'm looking at the chat.
Ronnie Heisman had a question, and I said I would make sure I made the meeting so Mr. Flynn could answer the question.
Oh, absolutely.
Yeah, I see that Ronnie Heisman says she's here.
Okay.
Okay, if she could answer the question, she did ask me this question 2 weeks ago, and I said I would make sure I start a meeting with Mike so he can answer it directly because I couldn't answer the question. Ronnie, would you like to ask him the question?
Jen, the
Hi,
question.
yes, I do. Okay. We had a question about contact tracing. Most of our therapists are in rooms where they're either the only therapist or there are two therapists assigned to a room. And we had a question about contact tracing because we really have contact with most of the kids, either by virtue of seeing them face to face or by the fact that our roommate in the room sees kids in the same class. And we did have a therapist that had done a push-in for half an hour in a classroom, a few weeks ago, and there was a quarantine situation in that room, and that therapist was told that she was, in the end, she was initially told to stay home on Monday, and then when all the contact tracing was done, they said for her to come in, that she wasn't included, yet all the other staff members and students were included in that quarantine situation. So we really have a question as to how they determine that. We're spending a half an hour with students, some of which are not masks. I have a caseload where most of my kids do not tolerate masks, but so we are spending that time either individually, or in this case, the therapist had done a push-in in the classroom during the time frame that I think there was some contagiousness going on or whatever. So I just want to know how we are determined whether we are or are not part of the quarantine situation if we're really having contact with an entire class.
Okay, Ronnie, thank you for the question. And it's actually a great question. And I know the situation well. So just to clarify, we make no decisions about quarantine. I
know that.
Okay, just to clarify it, I make an initial decision based on close contacts. So in that situation, the staff member that you're referring to properly put down their name on the contact tracing log. So we're able to do our job in terms of identifying in the initial report to the Department of Health everyone who is in that class and listed on the contact list. That's why we repeatedly emphasize to all staff, it's so important that when you go into a class, let the Department of Health decide, whether or not you should be quarantined. And Department of Health, so initially in that decision, I made a decision to ask that person to stay home. And that was based upon something that I've discussed previously. The initial protocol from the Department of Health in Suffolk County, it just wasn't working as well as it could. And I happened to be the person to call up the deputy or the associate commissioner to ask for a call with the commissioner, because the Department of Health was taking anywhere from usually 2 days to investigate an incident that was brought to their attention. Well, the problem is that while you're taking 2 days, the people who had the contact are in the same classroom while it's being investigated. And that made no sense to me. So the commissioner agreed. And I said, school superintendents, because we don't have the authority to tell people to stay home not that anyone would argue that point. It's just that Mike Flynn can't tell Ronnie Heisman to stay home tomorrow. What I can do is I can say, we're asking you to stay home until the Suffolk County Department of Health. And no one gives us a problem on that. They understand the purpose of doing that. But that was my decision. And the way I make that decision is that we work with the Department of Health, and anyone who had any remote contact, I don't take any chances. We just say, stay home. And we'll wait for the Department of Health to complete their investigation. So once they complete the investigation, then they'll make a decision on whether students are quarantined or not. We just had a situation where there were 2 kids in another school who had exposure to a bus driver, and they were not quarantined. And I happened to ask the question in Suffolk County because I want to know myself. And they gave a rationale that there was only 2 kids on the bus. It wasn't a long trip. The windows were open. Everyone was socially distanced. Everyone's wearing masks. They have actually a point system. They have a committee at the end of the day. It meets at 2:30. It's comprised of doctors and nurses, and they have point systems that they assign based on different criteria. I don't know the point system. I don't know the criteria, but I could guess it. You know, social distance, ventilation, the obvious things. So in the case of the speech person, again, I asked the question because I was curious. I wanted to know, just my own edification about what is the Department of Health thinking about in terms of exempting a person. And the answer in that particular case was the length of time in the class, because it was a push in speech therapy. So it was a short period of time relative to the issues. It was more than 10 minutes, but it was I think it was like 27 minutes, whatever the amount of time was on the log. The other thing was that the student and the speech therapist were both wearing masks. And there was, whatever the social distancing was indicated to the Department of Health. They made a decision that she didn't qualify to be quarantined. Without getting into specifics, because, I did have follow-up conversation, which I like to keep private.
I think the question we had too is, there will be a time when you'll say, well, please stay home until we get a determination. And staff members are worried about the use of their sick time, because not everybody has, enough of accumulation of days, or they're concerned because they've used days for other situations in years prior, that they are, they're concerned about the use of their sick time. That was one question. And I think anybody would have that question. I mean, we all get that we want to stay home while we're waiting for the determination because you don't want to spread it. But again, we have these concerns as well.
Well, let me just finish, and then I want to answer that question, because that's a good question you just raised. And I have an answer I think is important. So what we do tell people in this situation is that you have a right to call the Department of Health. And that's your right. Pick the phone up and ask the question that you're asking now. Because I don't want to defend that decision. I want to say that they have a good system in place. I know these nurses, I know these doctors, some of them, know one of the doctors. And I'm not in a position to even, other than to tell you what they told me, to answer that question. But I do tell people all the time that there's nothing wrong with you picking the phone up and calling the Department of Health and asking that question. Absolutely nothing wrong with it at all. And if you're worried about it or you're concerned about it, you should do it. That's what I tell people. But Ronnie, to your question, I made a decision and I notified all the principals. If I assign you to stay home, it's not an official quarantine, but I've made a decision. Staff are not going to be docked in terms of pay, so that I treat that as tantamount to a quarantine day in terms of pay. Because again, that's not fair. It's not fair if I'm telling you to stay home because of something related to a possible quarantine and you get docked for that. So that's something I made clear. Ronnie, are you aware of a situation where someone's been docked who's been asked to stay home?
No, it was a concern. And I think everybody just wanted that clarified to know. I know that I think one of the last conversations, or maybe at the union meeting there was something about how our system is set up so that people were getting charged days, but they were given back. That wasn't even the consideration. It was that the member themselves was not confident that they were going to not be charged for that day. And so, that is what people, the question that was asked. Well, if we're asked to stay home, is it coming out of our sick bank? And you just answered that quite clearly.
Yeah, thank you for answering the question. Maybe we got to do a better job of spreading that word around. But I know that the principals, when they call people, they've been asked to make that clear. to take, because look, if you're told to stay home because of a health issue, you're going to stay home. But if you have no sick time and you're going to get docked for that, it's going to weigh on you. And we don't want that to happen. We want to take care of people. So people are supposed to be told when they're asked to stay home that you're not going to be docked for that. And when it comes to quarantine, there's no limit on quarantine at all. It's unlimited. It can, as many times as it happens, you're never docked for that.
Mr. Flynn, is that in writing anywhere, or is it in writing to Ernie, to the different units? I just want to ask that as well. Or is it just just an agreement, that you've made?
It's a question you don't want to ask me in a public forum.
Okay. Okay.
But my answer stands.
Yes. Okay. Thank you.
Jen, Devin, are there more questions that members have or concerns that so we can?
That is everything that we were able to identify from the chat and from some of the concerns that were shared with us prior. So we are all set.
Okay. Thanks,
Mr. Flynn,
Ernie.
thank you very much for enlightening the members as to where we are, what is going on, and what does it mean. It's very difficult for me personally or the union side of it to explain things when we do not directly have immediate access to information that comes down from the state. But on the second end of it, I think you answered the question that were asked. The only one thing that I just want to make sure is clear is that when and it relates to Ms. Heisman, when she said that, is this something that there's nothing we can agree on. Everything is based on what the state lays down. Outside of that, Mr. Flynn, you're free to go. I'm sorry I put it that way.
Well, again, thank you. I enjoy these conversations. It really helps to give me a pulse on what's happening. It helps me inform me to try and make the best decisions. I wish other groups would do this. I've invited every other group to do it repeatedly. And I appreciate the fact that the teachers take advantage of it. I again, thank you for providing me with the opportunity to have the conversation with you. Okay, everyone, have a good evening. Take care.
Thanks, Mr.
Thank
Flynn.
you.
Okay. Jen, you are the sergeant at arms. You make the decision. We answer questions here now. I am available to answer.
The opportunity to have the conversation. Okay, everyone, have a good evening. Take care.
Thanks, Mr.
Thank
Flynn.
you.
Jen? Okay.
Yes,
Jen, do we need to? You are the
I am
sergeant
here.
at arms.
We're all set.
You make the. Jen, are there questions that members have that perhaps we can help them with, or Jen? Hello? Am I still online? Okay. Jen, you are the
I am here. We're all set.
You make the. Jen, are there questions that members have that perhaps we can help them with? Or?
No. It seems everybody seems to be signing off. I think this is a good place to wrap it up. Mhm.
Jen, are we still here? I mean, I got,
Everybody's logging off. I think it was a great ending, and we're gonna stop it here.